Hello, greetings from Aster Hospitals, Bangalore. My name is Dr. Anoop P. I am consultant hematologist, pediatric Haemato-Oncologist and bone marrow transplant physician. Here we have our friends from Ethiopia. So Awel is 29-year-old. He came to us about 5 months back, and Saddam is his younger brother, who has been his donor for bone marrow transplantation. So let Awel explain little bit about his disease and treatment.
Okay, my name is Awel Osman. I come from Ethiopia. I am 29 years old. So my disease is CML, means Chronic Myeloid Leukemia. Because of that reason, I come for bone marrow transplantation. I have to Aster Hospital, so I get more service from Dr. Anoop and as well as nurses. All hostility of this Aster Hospital is very good.
I'll explain a little bit about Awel's disease. So most patients with CML, chronic myeloid leukemia, do not require bone marrow transplant. Awel's was a little bit aggressive. So initially it was in chronic phase for a few years, but then recently from end of 2023 second half, so that time onwards the disease changed character and he went into a more aggressive phase called blast crisis of the chronic myeloid leukemia, and he was resistant to medicine called imatinib. And when he came here, in addition to CML and blast crisis, he also had enlargement of the spleen and secondary fibrosis in the bone marrow. So this is a challenging situation. We had to treat him like an acute myeloid leukemia with very strong chemotherapy, and during that time he was admitted for about 1 month, and that itself was challenging because he had a bleed inside the brain during the treatment, but luckily he came out of it without any problems. So, and also fortunately his brother Saddam was a 10/10 matched donor, so we have a donor as well as we have a patient whose disease was cleared with chemotherapy. So we went ahead with bone marrow transplantation. Again, the risk of recurrence of that bleed was very high during the transplantation. We explained the risk. He accepted the risk, understood that there is no other solution for this disease. So we could do the transplantation in March of this year. Now it is end of June. He is now day 95 from the date of transplantation. He is ready to go back to Ethiopia next week. He has had a few complications during and after transplantation. All of them have been now sorted. He has got 100% donor chimerism, which means his bone marrow has been now replaced by Saddam's bone marrow. His blood counts are normal. He will be on medicines for some time, and I expect him to do well.
Okay.
So all the best.
Yes.
Sometimes we'll meet in Ethiopia or when you come back to Bangalore.
Okay.
Thank you.